My name is James Dennis. I'm from Liberia and I suffered from cardiac blockages in Liberia. Basically, I was advised to do a triple bypass surgery. In consultation with my Liberian doctor, I asked him to suggest, where could I come to in India? The best hospital you can go to there is Apollo. So I said, please make the contact. I gave him all the medical records which I had from Liberia, from Ghana. He made all of the arrangements with Dr. Varun, who is a specialist in that area. I came to India along with my wife and my daughter.
Mr. James is a very nice gentleman. He's a 66-year-old male from Liberia. So he came to us with a history of triple vessel coronary artery disease. He had got his angiogram there, but unfortunately he could not bring his angiogram CD with him. So we rechecked his coronaries. We found a triple vessel disease for him, and we were discussing options about robotic cardiac surgery, open cardiac surgery, everything. Even in the echocardiography, it was found that his heart was functioning very less. The heart function was around 25%.
Walking slow, constant tiredness, easy fatigue, and you have to, when you walk 100 yards, you have to stop, wait and rest for your heart to come back down. So it posed a problem for me in my teaching career because I had to be moving around. I had to climb steps to go to my classroom.
So we did a viability test on him. We checked what all segments of heart were not getting good supply. Out of the three, one was getting very nice supply, did not require any myocardial vascularization. The other one was almost dead. The third one, which was hibernating and required more blood supply, was the anterior segment. So we discussed with the family, we discussed amongst each other with the anesthesia team. We were thinking how we could do it robotically. And then finally, when we made the decision, we discussed with Mr. James and his family, and they were happy that we had finally decided to go ahead with robotic surgery, even though there was a risk of conversion of around 1 to 2% to open if required.
Then he explained about robotic. Now it's minimally invasive but robotic. So that's what we opted for.
So he thankfully agreed, and then he underwent robotic assisted CABG. We put one bypass graft and he started moving first day out of the ICU. But as his heart function was not very great, so we kept him in ICU for a couple of days more. He was in step down, started moving around.
It has been 1 week since my surgery. I'm now walking around a little bit, not as much as I used to. My heart rate when I came here, it was operating at 25%. I understand that it is now about 45%. So for me, that is good.
And by the end of 10 to 12 days, I hope that he'll be fit to fly back home. The beauty of robotic cardiac surgery is because of smaller incision, no cutting the chest bone, we could actually help him go back to his normal activity within a short span of time. He doesn't need to rest a very long time.
Dr. Varun's experience with me was highly positive in that he took a particular care, and whenever we called upon him, he answered at any point of the day or night. The experience with Apollo Hospital was very good in that this is probably one of the largest facilities of its kind, 24/7 operation. And any hour of the day or night you come here, people are here. You can do any kind of test. It was a good experience that they are ready to provide medical services on a round-the-clock basis.